We are live. We are live. I'm Dr. Frita. Welcome to another Medical Monday where we talk about all of the hot health topics in the headlines. Listen, I want y'all to buckle up because we have a fast-moving show today with a lot of health topics. We'll start off with my favorite game, Myth versus Fact, because we have a commentator, Camryn Kinsey, who actually fainted while on a news show. She fainted during an interview. So we'll talk about fainting, some common causes, and what to do if you actually faint. And then we'll get into our weekly dose where I'll give you a fresh take on the medical headlines that you simply can't get anywhere else. We'll start off talking about Al B. Sure. You know Al B. Sure, R&B superstar. He's also been linked to P. Diddy. Yes, this is how. He had multi-organ failure, survived a liver transplant, being on a breathing machine, and he is coming out speaking boldly with no ambiguity, stating that he, I'll be sure, believes that Sean Diddy Combs is responsible for his multi-organ failure and almost dying. Yes, he states it outright. He also states that the late Kim Porter, you know, the mother of P. Diddy's children and the mother of one of Al B. Sure's children, he states that he doesn't believe that she died of pneumonia. He also believes that P. Diddy is responsible. He's coming out strong. His words, not mine. But we'll talk about these things, and of course, we'll relate them to the health for all of us to learn. And then we're going to talk about my subject, kidneys. Y'all know I'm a board-certified kidney doctor because NBA star Nate Robinson has received a kidney transplant, and the person who gave it to him will most definitely surprise you. It surprised me very, very happily so. Do y'all know the show That's So Raven? You know the show That's So Raven. Well, one of the stars, the dad, Ronald Sheridan, is sharing that he is living with pancreatitis, and he's actually requesting a GoFundMe because he's having some difficulty with medical bills. We'll talk about pancreatitis, causes, how to recognize it, what to do about it. And then, of course, we'll have our 5-minute health check where I very quickly will run through some outbreaks, some recalls. You don't want to miss that. This is, of course, a live show, and so we'll be interacting. I'll ask you questions. You'll ask me questions. I'll ask you questions, and we'll have a great time. But come on, let's get started. I'm Dr. Frita, and this is Medical Monday. All right, we are live. I'm Dr. Frita. Let's go ahead and get started. You know I'm not doing this thing all by myself. To my co-host and my practice manager of more than 12 years, Miss Shador, please come on up to the front of the stage. How are you doing, Shador?
Hey, good, Dr. Frita. How are you today?
I'm doing well. Did you have a happy Mother's Day yesterday?
I did. How about yourself?
It was a wonderful Mother's Day. It was just a wonderful weekend. My nephew, my brother's middle child, graduated from Berry College. He got his master's in business administration, his MBA. He's also a coach there, you know, a coach for the football team, the cornerbacks. He did very well. So went to his graduation on Friday. Then we traveled to South Carolina to see my cousin, my first cousin's daughter, Dallas Schumann, graduate from Furman University, summa cum laude, with a major in neuroscience and a minor in data analytics, if you please.
That's great.
Very excited. Listen, the graduation was outside. Listen, for anybody who's on IG, who's listening, hey, y'all, thank y'all for the support. I posted an IG live because, yes, we were sitting up outside in the stadium in the rain with raincoats and all kinds of things. But we were there, and it was very exciting. And just watching all of that excellence, Shador, it makes me so excited because, of course, my little cousin who graduated from Furman is a Black female. And I want to ask y'all in the chat, do you know which demographic in the United States earns the most college degrees? Who earns more college degrees than any other race, gender in the United States? I want y'all to put that in the chat. But anyway, I'm just very excited, very proud for Mother's Day. You know, of course, I have all my 3 kids. My mother was with us. She had a lot of good surprises and had a great Mother's Day. I think she's still celebrating Mother's Day. But just a really great, feel-good weekend, Shador. Yeah.
Wonderful, wonderful.
So who was the first person in the chat?
First person today, Purple Onion.
Hey, Purple Onion. That's one of my favorite names, Purple Onion. I do love purple onions. Very good. All right, so let's go ahead and get started. And if you see anybody who put the demographic, who gets more college degrees than any other race or gender?
Oh, IG. We got someone from IG chimed in.
IG? Who?
Snaz. Say Black women.
Snaz. Let me tell you something, Snaz. Come to the front of the class because that's correct. Black women earn more college degrees than anyone else in the United States. We are the most highly educated people, period. Race, gender, go across the lines. We earn more college degrees than anyone else. And I bring that up because, you know, for anyone who's following politics and following all this anti-DEI, DEI hire, you know, it's aimed for Black people, aimed at women, aimed at brown people, aimed at, you know, immigrants, things of that nature. And the implication is that if you're a Black female, then you're just placed in a position for charity and just to fill a number. But this is just a reminder that the facts don't lie. My cousin, that little girl, Dallas, summa cum laude, neuroscience, data analytics. Let me tell you, you want merit, you want meritocracy, that's merit. So for everyone who's listening to the sound of my voice, don't believe the hype. Don't believe the hype. This DEI, making it a negative word, negative connotation, that is garbage, okay? You want merit? I'll show you merit. You want college degrees? Check out Black women because we have more than anyone else. All right, back to the current programming. Shador, fainting. Have you ever witnessed anyone faint? Oh yeah, I know you have because we witnessed it in the office.
Yeah.
It's pretty scary, right?
Yep. Mm-hmm.
And a lot of people, you know, they want to act, they want to do the right thing, but they really don't know what to do when someone faints. So we're definitely going to talk about this. And someone should have talked to this host on Fox 5 channel because a commentator, Camryn Kinsey, actually fainted right there live while taping. So let's take a look at this clip, look at the actions, and then we'll talk about what the actions should have been. Let's play the clip, Shador.
Take a look at this. It is a very scary moment on live television as a guest faints right in the middle of her sentence. Here's what happened.
This guest on the Fox News channel is live on air, but she's not feeling quite right. Political commentator Camryn Kinsey struggles to find the words.
Ideology, or it's not about.
Then this happens.
Oh my goodness.
Kinsey just fainted on air, and the host, Jonathan Hunt, is flummoxed.
Let me come back to Lydia while we get some help for Camryn here. Lydia, the President, we're going to go to a break right here. We'll be right back.
That was scary.
Oh my goodness. We're just going to get some help here.
A Fox spokesman says she's now feeling much better and wish her a speedy recovery.
Oh my goodness.
We wish her a speedy recovery too. Glad to know she's feeling better.
All right. Now that was scary. Listen, if y'all have ever seen anyone faint, I want y'all to type out faint in the chat if you've ever witnessed someone faint. And now I actually want to talk about some of the causes of fainting, and then more importantly, what to do. And if y'all know of any causes, go ahead and put those in the chat as well, and I'll go ahead and get it started. Okay, so what happens when you faint is that you have a decrease of blood flow to the brain, right? And when the brain has a decrease in blood flow, then you literally lose consciousness. The good news is that with most fainting, it's temporary. It might last a matter of seconds. And oftentimes the cause is not something that's life-threatening, oftentimes, but sometimes, of course, it is. And so we see people faint quite frequently. And I tell you, as a physician, it drives me bananas because I watch folks do the wrong thing and I watch folks react to a person who's fainted, and they do things to that person that will actually make the condition worse. And so we're going to talk about that. But so far, Shador, has anyone in the chat put some causes of fainting? And please go ahead and give us a like. If you're here on YouTube, give us a like and a subscribe. I'm very excited to announce that here on YouTube, on the Dr. Frita channel, we have over 855,000 subscribers. Oh, I appreciate y'all so much. We are slowly marching towards 900,000. So please go ahead and subscribe if you haven't. If you have not, we have hundreds and hundreds of videos where I share evidence-based medicine in a way that's easy to understand. I'm telling you, I talk about lupus, I talk about kidney disease, high blood pressure, how to lower blood pressure naturally, diabetes, how to lower your blood sugar naturally, top exercises for lowering blood pressure the natural way. I talk about medications that can damage your kidneys. I talk about lung cancer, prostate cancer, breast cancer, cervical cancer, you name it. I just about have a YouTube video on it. And what happens when you watch my videos and the way that I break things down, if you have a question about things, it helps you to understand better for yourself. Or if you're going to see your doctor, it helps to provide an outline on questions to ask to give you your best care. So please go ahead and subscribe here on our YouTube channel. Also, I thank you to my followers on Instagram. Y'all come give me a follow if y'all are on there. Come on, give me some Mother's Day presents on Instagram at dr.frita and Facebook as well. All right, Shador, has anyone answered any causes of fainting?
Yes, I remember Miss Cynthia. Hi.
Hi, Miss Cynthia. Thank you for being a member.
She says dehydration.
Absolutely. Being dehydrated. And it's tricky, Miss Cynthia, because by the time you feel thirst, the sense of thirst, your body and your kidneys are already dehydrated. So yes, being dehydrated can definitely be one of the causes of fainting. And before we go on with the other ones, hold those, Shador. Let's do our myth versus fact. Okay, I'm going to give you a couple of myth versus fact statements, and then we'll continue talking about causes of fainting. So go ahead and be putting those in the chat, please. All right, myth versus fact statement number 1.
If someone faints, you should quickly try to sit them up in a chair.
All right, if someone faints, you should quickly try to sit them up in a chair. Is that a myth or is it a fact? Put an M1 if it's a myth. Put an F1 if it's a fact. If you see someone faint, go grab them and sit them up, sit them up, sit them up. Is that what you should do? Put an M1 if that's a myth. If that's not what you should do, put an F1 if that's a fact, if that's the right thing. All right, let's do myth versus fact statement number 2, please, Shador.
If someone faints, you should immediately give them water.
All right, these are more of those things to do when someone faints. If someone faints, you should immediately give them water. You know, Miss Cynthia, I remember already said dehydration is one of the causes, right? Okay, so if someone faints, you should immediately give them water. Put an M2 if nah, that's a myth. Put an F2 if that sounds right, if that's a fact. Now, y'all know when I ask you these questions, I do like to trick you. I mean, is that like mean? I don't know, but I feel like if everyone gets it right, I haven't taught you anything. But if it's a mixed bag, it's so fun. All right, pencils down. Let's see who gets these right, Shador. All right, statement 1. If someone faints, you should immediately get them, sit them up right. M1 if that's a myth, F1 if that's a fact.
All right, I don't think you can stump them on this first one, Dr. Frita.
What?
That one's saying myth. So we have
Yo, get on my nerve.
Ms. Paula says a myth.
Miss Paula, you weren't buying it. You said it's a myth. Don't sit them up. All right.
We'll try to pronounce his name. Hopefully it's correct. I'm sorry. Cheslin.
Hi, Cheslin. Myth?
Myth as well.
All right.
I remember Miss Andrea says a myth.
Okay. Miss Andrea says it's a myth as well.
And Tijuana says it's a myth.
Tijuana says it's a myth. No one said it was a fact that you should sit
No
them
one
up.
says it's a fact, even from IG.
Hey, IG.
TK Lopez says
IG. Who is that?
TK Lopez.
Hey, TK Lopez. You said it's a myth. TK Lopez over there on IG. Check out my IG live that I did Saturday, honey. I was singing in the rain and sitting for graduation. So you said it's a myth too. Oh, TK Lopez. All myths.
All myths on this one.
Well, let me ask y'all this. Okay, so the correct answer is myth. It's correct. You should not sit them up right away. But I see people do that so many times. Give me a wave, like put the little wave emoji if you see people sitting people up. That's the first thing they want to do when they see someone faint. But it's the wrong thing to do because, as we mentioned, when someone faints, there is a decreased blood flow to the brain. If you sit that, and so the body is protecting itself by having you to fall down so that the gravity, instead of keeping the blood down, perhaps some gravity will put some blood flow back in your brain. When folks run and sit someone up, just because it makes us feel more comfortable, you know, when people aren't lying down, when you sit a person up, that's decreasing perfusion or flow to the brain. And so the worst thing you can do is sit a person up after they faint. If they faint, leave them down there. Leave them down there on a flat surface, and you want to lift their feet above their heart. So lift the feet up about maybe 12 inches, because that's also going to increase blood flow to the brain to fix the problem. There's some other things you'll want to do as well. One, you know, once you're out of the more acute situation, you want to make sure they don't have the injuries, but most immediately you want to see if they're breathing. and if they have a pulse. If they're breathing and have a pulse, okay, then you're in a bit of a safer situation. If they're not breathing and or if they don't have a pulse, you want to start CPR immediately and look for an AED, automated external defibrillator. We'll get more into it. All right, I didn't trick y'all on that one. Oh, but here's round 2. All right, what's that statement number 2? Here we go.
If someone faints, you should immediately give them water.
All right, M2, who said this was a myth that you should immediately give them water? And who said yes? You know, since we know fainting can be caused by dehydration.
All right, we got a mixed bag. We do have a mixed bag on this.
Mixed bag. I got somebody. All right. All right.
All right.
We should
Our
immediately
myth
give them
takers
water.
are M2. I remember Miss Cynthia.
Miss Cynthia, wait. Hi, Miss Cynthia. I remember she said it's a myth. She said you should not give them water immediately.
Says a myth.
You know what, Cynthia? Okay, who else?
Camille also says a myth.
Camille, you said we should not give them water immediately. Now, y'all the ones, Cynthia, Miss Cynthia, you said it was dehydration as one of the causes. Okay, we'll see who's right. Who's right? Who's wrong?
Lisa also says a myth.
Okay, Lisa says a myth. So we got Cynthia, we've got Lisa, and who else said it was a myth?
Oh, that's for sure. Go back.
Oh, you have to go back. Okay. All right. So now who else do we have?
Our fact takers on this one, we have Adrian.
Okay. Adrian's like, she knows dehydration is a cause. Give him some water. Okay, so she thinks it's a fact. Hi, Adrian.
Also, Laverne.
Hi, Laverne. You think it's a fact to give them water. Okay.
And Miss Aileen says a fact as well.
This is Miss Aileen.
Yes.
Hi, Miss Aileen. Hello, welcome back. You say it's a fact. All right. The answer for this, if someone faints, you should immediately give them water. Drum roll, drum roll, drum roll. Is actually a myth. It's a myth, but there's nuances to it. There's nuances. So if someone has fainted, then they're unconscious. And so you definitely don't want to try to make them drink while they're unconscious, because then they'll aspirate, they'll breathe into the lungs. And maybe some of you said immediately, you meant immediately after they wake up. But I'm mentioning this because I've seen this done as well. They try to sit people up and while they still have no consciousness, they're trying to give a semi-conscious or unconscious person water. And that's a very bad thing to do, because if they breathe that water into their lungs, then they can get aspiration pneumonia, they can choke, you can have a whole other host of problems. So for those of you who put myth, who are actually thinking while they're dehydrated, try to give them water, that's absolutely a myth. Okay. The fact of the matter is you lie them down, as we discussed, lift their feet up, start CPR if there's no breathing and no pulse. And if they do wake up within a matter of seconds, less than a minute, they don't seem like they have injuries, and they do want to sit up, eventually you still have them have their head down low, underneath their heart. And, depending on the cause, they should certainly consult with their physicians. Now, getting back to causes, did anyone else put any causes? We know Miss Cynthia, our member, said dehydration. Do we have any other causes, Shador?
Yes, we did. We have over from IG. SNAD says low blood sugar levels.
That's a good one, Snaz. Low blood sugar levels or hypoglycemia can definitely be a cause of fainting. That's a good one, Snaz.
Yeah, and Jeanette agreed with the hypoglycemia. Hypoglycemia.
Absolutely. And that's why it's so important for people who are taking insulin, especially the short-acting insulin. You have to time that eating just right, because if you don't eat enough, you take that insulin, that blood sugar will drop. Or if you're someone who skipped meals. And for Camryn Kinsey, we don't know the case with her, but if she's been rushing, moving, going, getting ready for this show, we don't know if she skipped a meal and her blood sugar dropped. That could be a cause of fainting in addition to dehydration. Any other causes?
No, I mentioned as of yet.
Okay. But yeah,
Jason.
Hi, Jason.
Hi, Jason. Jason says orthostatic hypotension.
Thank you. Come to the front of the class. Orthostatic hypotension. So that is when you stand up. You come from a seated position or a lying position to a standing position, and that blood flow in the brain drops. Your blood pressure drops, and you can faint. Okay. And this can happen for many reasons. If you're dehydrated, it can happen. If you have cardiac issues, it can happen. If you have arrhythmias, or if you just simply stand up too fast and your body hasn't had time to acclimate. Certainly if you are taking certain medications that could slow down your heart, like beta blockers, metoprolol, atenolol. So when you get ready to stand up from a seated position, it's best, let's say if you're lying down, sit up first. Pump the muscles in your legs. That helps to squeeze the veins and get the blood flow up, and then stand up slowly. Okay. And then stand up slowly. If you notice you're someone who stands up quickly and you get kind of lightheaded, then start doing that. Make sure you're hydrated. Consult with your physician, of course. But orthostatic hypotension, when that blood pressure drops because you've gone from a seated or lying down position to a standing position, and that blood perfusion, that blood flow drops in the brain. That was a good one. Yeah. All right. Any other ones?
No, you asked for a wave.
Oh, you see people try to sit folks up. It's just what everyone seems comfortable with doing, right?
Mm-hmm.
And and I've been at different, like I was at one of my kids' games, like a football game, and someone fainted. It was a middle school game, and all the people coming out like heroes and the men coming out, sitting the person up. I was like, no, let them lie down. And they're looking at me, with my bamboo earrings, at least 2 pair. And I just have to go ahead and tell them quickly, I'm a doctor. So they'll move out of the way, because you always have some people in the crowd who think they know and they don't know. But yeah, you keep them lying down. Yes. So orthostatic hypotension is one. Other causes, vasovagal. So the vasovagal occurs when there is a reaction. It could be an emotional reaction, like seeing the sight of blood, having fear, and it will cause a vasovagal reaction, which makes the heart rate slow down. That decreases blood flow to the brain, and you faint. Okay. So people who faint when they're scared, when they faint at the sight of blood, when they faint when there's, just a lot of fear or some type of a trauma, that's a vasovagal reaction. Here's another big one, Shador. Listen, when you're straining to use the restroom. Okay. If you have a cough, urinating, bowel movements, a strain, that Valsalva maneuver can cause you to faint. Okay. A lot of times you'll have ambulances called and the person is sitting in the restroom and you know that they have fainted or had something happen to them while they were sitting down. What else? So we talked about dehydration. We talked about, medications can do it. If you're taking diuretics like water pills and you are over diuresed. So if you're taking too much Lasix, furosemide, hydrochlorothiazide, that can cause a fainting. Also, certain blood pressure medications, if you're taking it and it's causing a side effect. So like we mentioned, the metoprolol, things like the beta blockers, which are great drugs. I prescribe them. They're safe for the kidneys generally. They're heart protective, but they have a side effect where they can cause a slow heart rate. And so if you're taking metoprolol, carvedilol, Coreg, atenolol, labetalol, Bistolic, something that's causing your heart rate to get down too low, if it's causing you to have a very slow heart rate, then that could cause some fainting as well. What else can cause fainting? Low blood sugar. We already had the low blood sugar mentioned for sure. So you want to make sure you don't skip meals, things of that nature. Those are some of the major causes. Now, you can also have a cardiac cause, something more serious, like if someone has an arrhythmia. Okay, you can have like idiopathic hypertrophic cardiomyopathy. That's congenital. I know that's a mouthful, but we talked about some cardiac causes, Brugada syndrome, things of that nature. Certainly, if you have a heart attack or if you have an arrhythmia from commotio cordis, y'all remember we had Damar Hamlin who had that when something hit his chest. Many cardiac causes, and actually. Right here on the YouTube channel, on my Dr. Frita YouTube channel. Hi, once we're finished, if you go in the search bar and you put Dr. Frita cardiac arrest, you'll see where I go through a whole list of cardiac causes of fainting. Bottom line, if someone faints, lie them down flat, lift their feet up, make sure they have a pulse and that they're breathing. If they're not, call 911, look for an AED, automatic external defibrillator, and start doing CPR. I don't care if you're not certified in CPR. You can do CPR without respirations. Go ahead, look that up, American Heart Association website, or just look up CPR hands only. And we've got Good Samaritan laws. You can save a life. All right. So I hope Camryn Kinsey is doing well after fainting for the world to see. I'm sorry that happened to you, Camryn Kinsey. I am thankful that it gives us a chance to talk about it so that we can help others. All right. So now let's get into our weekly dose where I give you a fresh take on these headlines you simply can't get anywhere else. As we move into it, please make sure you give us a thumbs up. Please give us a like. Please give us a share. Let YouTube know we're here. We're here. Get used to it. And please share on IG, share on Facebook as well. All right. Have any of y'all heard of Sean Diddy, P. Diddy, Puff Daddy? We've been talking about him for so long. And now this week is finally going down. They're starting the trial, jury selection, all of those things. Well, We know that he has been accused of all kinds of things: racketeering, sex trafficking, violence, domestic abuse, which he actually admitted at least to being violent against his ex-girlfriend, Cassie Ventura. Now he's coming out after they tried to keep that tape that was discovered on CNN of him brutally being violent on her, attacking her, kicking her, all those things. He's saying, well, she hit me too. Both of us hit each other. Anyway, but Albie Shore, let's talk about Albie Shore, because that's who's been sharing his health issues. So for those of you who don't know, Albie Shore is like a star from the 1980s, I believe, definitely like early 1990s, but yeah, I think 1980s. He goes back. Albie Shore, an R&B guy, sex symbol, heartthrob, all of those things. Really good music. Really made a huge mark in the R&B industry. Well, he fathered a child with Kim Porter. Kim Porter then, after him, dated P. Diddy and went on to have more children with Diddy. And Diddy actually raised largely Albie Shore's son. Okay, so that's their connection. Plus, they work together in the music industry. Well, Albie Shore had a mysterious illness where he went into a coma. He had multi-organ failure or multi-organ system dysfunction. He received a liver transplant. He was on a ventilator, a breathing machine. He had a tracheostomy, you know, one of those breathing tubes that's cut through your neck. He's had all of those things. And now he's coming to the front of the stage and he says that he believes that Diddy is responsible, okay, for his multi-organ, this healthy guy all of a sudden getting very sick. He also says that Kim Porter, of course, the late Kim Porter, who mothered one of Albie Shore's children and is the mother of P. Diddy's children, Sean Combs' children. She passed away in her 40s of pneumonia, an apparently very healthy woman. And Albie Shore was asked directly in this interview, we're about to show you a little clip of it. He was asked if he thinks that P. Diddy, Sean Diddy Combs, was responsible for Kim Porter's death. He said yes. So he's coming to the front of the stage. So we'll play this clip and then we'll talk about what multi-organ failure means. We'll talk about liver transplantation, which he does have a liver transplant. And we'll talk briefly about pneumonia, which reportedly Kim Porter passed away from. Let's play that clip, please, Shador.
And it's time.
So you were in that coma in 2022. You had the liver transplant, you had the tracheotomy, all that stuff that went on.
Multi-system organ failure.
Yeah.
60.
Right. Have they figured out what happened yet?
We will.
No, I mean, have the doctors medically, like, what happened to you?
Yeah, what happened? So,
because you just collapsed, right?
Yeah, so, you know, just mysteriously out of the blue, you know, which we do talk about in the book.
Yes,
what that,
I want to get into that.
What that process is. But yeah, so it's been quite a journey. And as I said, you know, even as it relates to writing the book, I went through many, almost, you know, more than a decade of being scrutinized and clowned by law enforcement, them telling me, you need some help. Sex trafficking, really? What's wrong with you? No way, you know, just but not realizing that they were also working for the situation.
Because you were hinting, saying,
posting,
yeah.
I get calls, take it down or else, so on and so forth.
But this is about Diddy, so let's be clear for everybody that doesn't know.
Diddy, who's about to, his trial's about to start. Yeah, yes. They're selecting a jury.
But you were on this train years ago.
Yes, many, many years ago. I posted some information that was, you know, basically trying to save my life. And thank goodness to my ex, you know, the wonderful Kim Porter, the late Kim Porter, who, you know, kind of warned me all along the way to, you know, just kind of watch your back, so on and so forth. And I didn't understand why.
Because of Diddy.
Basically.
Do you believe that she died of pneumonia?
Absolutely not.
Why? What evidence do you have?
She was in the best of health. We just saw each other prior to her passing.
Yes, he's making some very bold statements, and he's also talking about it in his book. But I'm also curious, and, you know, we don't know, and hopefully the truth will come out. How many of you, especially those of you who know who Albie Shore is and who are following the story and the Kim Porter story, to you, put suspicious if you think that, I know we don't know, okay? We do not know. Suspicious if you are suspicious that Sean Diddy Combs could have been involved with Albie Shore's multi-organ failure, a healthy person who now has had multi-organ failure, and or Kim Porter's death, a healthy young woman who passed away from pneumonia. Just put suspicious, if it looks suspicious to you, in the chat. And then I want to get into multi-organ failure. If you know of someone who's had it before, been in the ICU, had liver failure, any organ failure, put MOF for multi-organ failure and put a little comment, if you care to share your story with it. But yeah, suspicious, if it looks suspicious to you, again, we don't know the answer. We're not indicting him. We'll let the court of law do that. But I'll tell you right now, if I were in the chat, I would put suspicious. I would put suspicious, but that's me. That's an opinion. That's not evidence at this point. But now let's talk about Al B. Shore. So we said he had multi-organ failure. So what is multi-organ failure or multi-organ dysfunction? It's when two or more organ systems stop working well enough to support your body. So what are some of our organ systems? The respiratory system. Okay, so if you have lung failure and you require mechanical ventilation, like with a breathing tube down your throat or through a tracheostomy that's attached to a ventilator, then you have respiratory failure. ARDS is one of the common things you may have heard, acute respiratory distress syndrome. And so if your lungs fail, that's respiratory failure. So that's one organ system. You can have cardiovascular failure. So if your heart's not pumping blood effectively, if your circulatory system's not working and you're not holding your blood pressure, like if you're septic, like if you have an overwhelming infection and your blood pressure is so low that you can't live unless you have certain medications being dripped to keep your blood pressure up. Okay, that's a circulatory failure or cardiovascular system failure. Okay, of course, kidney failure. And for those of you who are new to me here on YouTube, Facebook, Instagram, everywhere where you're watching, and in the replay crew, hey, replay crew, give us a like, please. So I am Dr. Frita McCrae Fisher. I am a board certified doctor. I'm a board certified nephrologist, meaning I'm a board certified kidney doctor and high blood pressure doctor. I have also been board certified in internal medicine, pediatrics, and most recently, I received my board certification in obesity medicine. And so while I'm up here talking to you, yes, I like to learn a lot about a lot. I'm one of these women in that demographic who likes to get educated. But more importantly, I really enjoy sharing the information. So make sure you do give us a like and a follow and a subscribe on all platforms. So now, of course, I spend a lot of times working in ICUs. And so I've seen multi-organ failure quite frequently. So kidneys, yes, kidney failure. So when your kidneys, of course, are responsible for filtering out excess toxins, excess poisons, urine. Here's the thing that a lot of people don't know. If both your kidneys stop working, you can't live unless you have some form of kidney replacement therapy or renal replacement therapy like dialysis. So kidney failure, that's another one of the organ systems. Okay. And then, if you can have like a hematologic failure, if your blood won't clot properly, or DIC is one of the big ones, disseminating intravascular coagulopathy, where blood is oozing everywhere, liver failure. So these are just some of the systems. And if you have two or more systems that fail, we call it multi-organ failure. And I'll be sure this previously healthy, health conscious man had multi-organ failure to the point where he needed a liver transplant. Has anyone made any comments thus far in the chat? Y'all don't be shy. MOF, and then a comment if you know anything about organ failure, if you know of someone who's had organ failure. And then I'm just curious on this one, suspicious.
Yeah, no one commented about the MOF, but we do a couple people chime in with suspicious. It just kind of marked it. I remember Rosalind.
Hi, Ms. Rosalind. Good to see you. Thank you for being a member. Oh, for those of you listening who would like to be a member, click in the description or go to my one-stop shop, dr.frita.com. I give you members only videos. Every month we have a members only live where I spend the entire hour, however long we talk. I'm only answering questions from you. You can come on stage and you can get my questions. So all of those board certifications, all the knowledge I just talked about, you get a firsthand take on it. If you need a second opinion or you want to run something by me from your doctor, that's your chance you have full access to me every month for a members only live. And then of course you get custom emojis, shout outs, things of that nature. And it's just a great way to support the channel to our members. So thank you, Ms. Rosalind. Okay.
And Nora also says suspicious as well.
Yeah. Yeah. And again, we're saying we don't know, but it is very curious. And now that I see that so boldly, I'll be sure has stated that this is the case. I mean, he could be sued, right? If he's lying, for defamation of character, libel, all of those things. And we know that, Diddy's money is long, but he's coming out and he's stating it, putting it in a book with no fear. And I think many of us were suspicious, even when Kim Porter passed away, so healthy. Not to say that sudden, passing away can't happen to seemingly healthy people, but there are different coincidences also. If you've been following the Sean Diddy Combs case, for example, he allegedly, I'll say, blew up the car of someone, Kid Cudi. That's someone who had a romantic interest in his ex-girlfriend, Cassie Ventura. So these are different statements. It's alleged, we'll see at this point, but there's different acts of violence that he's been accused of. Of course, innocent until proven guilty. We'll just let the court of law play out. All right, so those are that's the definition of multi-organ failure. Thankfully, he lived. He did need a liver transplant. If you know of anyone who's had any type of a transplant, liver transplant, kidney transplant, heart transplant, lung transplant, if you know of any corneal transplant, then please put that in the chat, and you could put comments after there if you like, if you know of anyone who's had a transplant. Well, yes, he had a liver transplant. And here's something that's interesting about the liver, Shador. Now, for the kidneys, you can be a living donor and give one kidney because you only need one kidney to live and to live well. Okay. And if you donate a kidney, you're not stuck with half your kidney function. The other kidney bulks up and does the work of two. And guess what? If you are a kidney donor, your life expectancy does not change. Your life expectancy does not decrease if you're a kidney donor. Okay. And so please sign up and be an organ donor. If you have a loved one who needs a kidney, raise your hand, save a life. And then here's the thing with the liver, Shador. Now, while most liver transplants come from deceased donors, you can be a living liver donor. Okay, now if you have no liver and no liver function, you can't live. So how in the world can you be a living liver donor? Seems like it doesn't make sense, right? Well, here's the cool thing. You can donate a portion of your liver and your own liver will regenerate. So you'll get your liver will grow back. And even cooler than that is that little portion of liver that you donate to someone will grow into the functioning size that it needs to be. So the liver is actually a very dope organ. And so he did get a liver transplant. Now, if you have liver failure, y'all put causes of liver failure in here and put LF, and that'll help us to see your comment. Do you know what kind of things you can do that can cause liver failure, things that can happen to you? So we'll talk about the causes, but I'll tell you what results if you do have liver failure. You can have difficulty clotting, meaning you bleed out. If someone tries to put an IV in you, you might bleed. If you are touched or not touched either, you can have internal bleeding, and you can literally lose your life from bleeding out from liver failure. You can also get jaundice, okay? Yellow in the whites of your eyes, yellow skin, yellow in the palms of your hand, under your feet. You can get jaundice. You can also have many other problems with liver failure too. You can have neurological problems where you kind of get the shakes, you get confusion, okay, hepatic encephalopathy. So these are some of the things that can happen if you have liver failure. And some of the causes, anyone jump in there real quick about causes, Shador?
Yeah, a couple of people did. Nick Nack.
Hi, Nick Nack. Paddywhack, get a dog bone. Okay,
so Nick Nack, I remember Ms. Rosalind.
Hi, Ms. Rosalind.
And Francis. They all say alcoholism.
Yes, excess alcohol can certainly cause liver failure. Some other causes, hepatitis.
Oh,
right?
Okay, Cheslin. Okay, before you, I didn't make sure you didn't give away our answer from our.
Oh, we got some more. Oh, what else?
Yes. Cheslin says medication toxicity.
Medication toxicity. Listen, absolutely. A big one is acetaminophen, which is the generic for Tylenol. Shador, one of the most traumatic cases that I've seen is a young girl. This is when I was at Georgetown University Hospital doing my internal medicine pediatrics dual residency. And I was on the internal medicine side, and I was doing the ICU. I was the head resident on call for the ICU. Oh my gosh. And this was the same time when my grandma had passed. She was 90 years old. And I remember because I had my hair done because I was going to be going to those services. And so my hair was fresh and I looked really nice and I felt horrible already, but I honored that shift before I left town, to go to my mother. So I remember exactly how I looked and how I felt, and they were opposite. Yeah, I was young then, honey. I was in my 20s. But anyway, so the girl was only 19 years old, And I remember the attending was happy that I was on the case because I did med peds. So she was 19, so she was technically an adult, but a lot of 19-year-olds' bodies still act in a very pediatric fashion. And so I was able to balance both because I knew pediatric ICU protocol and I knew adult ICU protocol. But I remember going in to see her, and she had fulminant liver failure. And we found out that she had had a Tylenol overdose. And then in getting the story, and she was a beautiful girl. But her skin was yellow. Her whites of her eyes were yellow. She had blue-green eyes. She had thick, full blonde hair. She was a slender girl. She just looked so young and like she just had so much life ahead of her. But apparently, you know, she had made a big announcement, a production. She was upset that she was going to hurt herself. And so it does appear that she took probably a bottle of Tylenol. But I remember wondering all through that night, every IV we put in her, every central line, she would just bleed all around it. Her blood count kept dropping. We kept transfusing her. We had her on the breathing tube. We worked so hard trying to save that young lady's life. She didn't make it. And the one thing that haunts me about the case is that, you know, when you think about people who take their own lives, the ones, and it tends to be males who, you know, are absolutely serious, tend to grab firearms. They aim, well, I won't go into it too much. I don't want to mess up the algorithm, but there are ways to do things, you know, where you know it's going to happen. But a lot of times people who make a big announcement or tell everyone what they're about to do is oftentimes a cry for help. Or they think, if I tell you guys I'm going to do something and I go and I take some pills, hello, somebody find me, somebody save me, which of course they found her. But acetaminophen is Tylenol. You don't play with that, because even if they find you pretty quickly, which they did, you know, they knew that she was upset, but even if they find you pretty quickly, like in her case, in many cases, it can take you out. You can get fulminant liver failure and pass away. And so when we're talking about Albie Shore with the liver failure, he really could have been out of here. He really could not be alive today. So it's amazing that they were able to save him. He got a liver transplant. All right. Anyone have any comments? Look, I know I done took y'all
Marina
down to the ground today.
what I guess could be a liver failure, an autoimmune disease.
Absolutely. Autoimmune disease. So, I have patients with lupus, right? And we know, May is Lupus Disease Awareness Month. If you haven't watched it, I did post my being on Good Day Atlanta. I posted that this week where I talk about lupus awareness. Plus, I talk about it a little bit on the IG live that I posted Saturday. So check that out after this live, please. But yes, you can get an autoimmune hepatitis. So instead of your antibodies just fighting bacteria, germs, viruses of the outside world, your antibodies can turn against you and fight your liver and cause an autoimmune hepatitis. That's a very good one. Good. Y'all are all right with me. Good. Move to the front of the class.
Jason says Reye's disease.
Yes. Yes. And, you know, there's certain taking aspirin can lead to it. Yes, that's another cause of liver failure, especially with the fever in children. Consult your doctor before giving children aspirin. We usually talk about it, talk against it.
Okay. I remember does have a question, Miss Rosalind.
Hi, Miss Rosalind.
Liver disease. She said, what does it mean when individuals' liver levels is a 4 on their lab report?
Okay, so there are lots of liver tests. And so there's the AST, the ALT, and even alkaline phosphatase, we consider it. So there's not just one liver test that's going to give you that number. So there's probably some like another thing other than just liver tests that will tell you. But just in general, when you have elevated liver enzymes, if they're slightly elevated, that does not mean that you are in liver failure. But as with all of our screening tests, it's a warning that we need to find out, what's causing the high LFTs? You know, is your system telling you that you're drinking too much alcohol? I'm not talking about you. I'm talking about general you. Are you taking too much Tylenol? Sometimes certain drugs like the statins, atorvastatin, Lipitor, Zocor, Simvastatin, sometimes those cholesterol medicines, which are really great medicines for cholesterol and they're heart protective, help to prevent primary strokes. Sometimes they can cause high liver enzymes in people. And so having those elevated liver tests is sometimes a nice hint to let us know that perhaps you're taking something or even doing something that could be harmful to your kidneys. Yeah, but that isolated number 4 alone doesn't give me enough information to answer that one. Yeah, hold on to that question though, especially when we do our members only live Q&A, we can get into some long detail. Okay, right. Anyone else?
No, you asked about anybody witness multi-organ failure.
Yeah, have you heard of it?
So Jason
Hi, Jason.
It says witness multi-organ failure during stage 4 pancreatic cancer in the clinic.
Oh. Now, let me tell you. Now, I'm not sure if you're saying that you've actually dealt with pancreatic cancer. Let me know a clarification. If you care to share, you don't have to. But for the pancreatic cancer, pancreatitis, sometimes just having one organ that fails can trigger the failing of the other. For example, liver failure can trigger kidney failure, and you can end up with multi-organ failure when it starts in one place. But yes, if you've been in the clinic and you're having a serious illness, then that makes sense that you've seen some other people who've had multi-organ failure. When I did my fellowship, my nephrology fellowship at Emory, we had our transplant floor. And so the transplant ICU, and of course I was there mostly for kidney transplants, but we also had kidney liver transplants where sometimes people who had both the organ systems fail will get both of those. Also kidney pancreas transplants, KP transplants, as well as liver kidney transplants. But thank you for sharing, Jason.
Yeah.
Be on the lookout if he pops in and gives a little more detail.
Okay.
If you are a survivor.
Marissa knows someone who had a heart transplant.
Who had a heart transplant?
Marissa knows someone who has had a heart transplant.
Yes. Now the heart transplant, to me, that's the most amazing of all, because there's not a whole lot of time. And with the liver, if someone's a deceased liver donor, we have 12 hours, to keep the liver preserved and cool. We have 12 hours to get into another body. I don't believe we have that much time with the heart transplant. But listen, what reality star's son recently had a heart transplant? Which reality star's son, we talked about it here, recently had a heart transplant? I'll give you a hint. She's one of the Real Housewives, one of those franchises. Her son recently had a heart transplant and seems to be doing well. In fact, he had a baby. His baby's 6 months old now. Yeah, he looks good.
While we're waiting on that to answer, Dr. Frita. Marina.
Hi, Marina.
She says, I know people who have had kidney transplant, but they're on multiple meds daily, now having other complications.
Now, that's true. Once you get a transplant, then it's foreign to your body. And so, yes, we try to match you up with blood type and different antigens, making sure that whoever's donating the kidney, that organ is very similar to yours, but it's still foreign to your body. And in order to keep your body from rejecting it like some foreign object that it is, we give you multiple medicines to suppress your immune system, right? To push your immune system down so you don't fight the kidney. What's the side effect in that? Well, when we suppress your immune system, sometimes you don't fight pneumonia germs as much. You don't fight common cold germs as much. And so you can be at an increased risk of having an infection. And every medicine, as you know, has side effects. Of course, the benefits, we believe, outweigh the risks, the benefit being to keep yourself from rejecting the kidney, but you can have risks like low blood count, anemia. There are different risks. I will say this though, and oftentimes people with bad experiences speak the loudest on social media, but I can tell you that people who have kidney transplants versus those who are on dialysis, the ones with kidney transplants have longer lives, have better quality of life, okay? Longer lives and better quality of life. And that is the fact, study after study. And so please don't be afraid if you're someone with kidney disease, end-stage renal disease, to at least go to a transplant center, accept the referral that your doctor gives you so you get your information firsthand from the professionals who know. But you are right. They have a lot of medications. Sometimes there are complications, but not as many for if you're on dialysis long term.
All right. Linda chimed in. She has your celebrity.
Come on, Miss Linda. Are you coming to the front of the class or not? Which celebrity's child had a heart transplant recently?
Nene Leakes' son.
You got it. Come on up here. Everybody move out the way. Come to the front of the class, Miss Linda. Yes, Nene Leakes, who I dare say is the most memorable, most famous, most iconic Real Housewives star of all the franchises. That is my opinion. Love her or not, she has the most household recognition. And to me, she put the Real Housewives on the map, even though she's not with them now. So yes, Nene Leakes' son, her youngest son, had congestive heart failure, had a stroke, had hypertension. A lot of these things were happening during the lockdown period after 2020. But he recently had a heart transplant, which he shared, and he's been doing well. And he has a 6-month-old baby. Okay. So yeah, he had a heart transplant. That's a good one. All right, come on to the front of the class. All right, so we need to move on to our next stories. We've got to go through those pretty quickly. Let's talk about this next one. Still in my field, kidneys. The NBA star Nate Robinson, NBA star picture of health, everything going on, developed kidney failure and ended up having a kidney transplant. And the person who donated might surprise you. Let's play that clip, please, Shador.
Robinson has spent the last 4 years searching for a kidney and shared he would only survive a week or two without a dialysis machine.
I just know that God is real in my life and in his life.
I remember staring at my reflection, wondering if the person looking back would still be there in a year. That's when you understand what it means to be truly afraid, not of dying exactly, but of leaving things unfinished. I remember one time I was driving my daughter to playing a basketball camp out in Portland. It was just me and her. And right when we got there, I got sick. I started throwing up and I had to go to the hospital out in Portland. And then I told my daughter, I was like, we got to get home. You ask yourself, why you? You know, why me? Why me? But the man upstairs always has a better purpose for you that you can't see yet.
When I learned about Nate's kidneys failing, it wasn't a question of if I would help, just how soon I could. People ask me why I did it. Why give a part of yourself to someone else?
Shane took 3 of the kids to the spring football game. He came home and said there was a thing on the big screen saying that Nate Robinson needed a kidney and had a QR code for it. And I said,
do you own your own home in Georgia, but still rent your electricity for a limited time only in specific zip codes?
Okay.
Yeah. So as it turns out, Nate Robinson, this NBA star, ended up getting a kidney from a stranger who saw a QR code. This is what I like about this story. How selfless, right? How altruistic. He didn't know Nate from anybody, but he put his name on the list, typed it up, and he said it took months before they reached him, but apparently he was a good match and was able to donate his kidney to a stranger. So then you might think, why would you donate your kidney to a stranger? And his wife, who we saw speaking just then, actually had donated her kidney to someone years before. She already had one child when she donated a kidney, and then she had 2 more children after the kidney, which also goes to what I was saying. You still have a great lifestyle, great life expectancy. She had 2 more babies after she donated a kidney. And what the wife shares is that she feels like her life has been so blessed. She's had so many blessings since giving the kidney. She feels like she gave her gift, but has had so many gifts since. And her husband knows that. And what a positive outcome she had, how healthy she is, that he was moved when he saw that this Nate Robinson person needed a kidney. They keep it real, though, because they say their oldest son was like, who is this guy? You know, we don't know him. We don't even know if he's a good person. And so they actually did go and meet him before donating the kidney. But it's just amazing how unselfish some people can be. And so now Nate Robinson has a kidney. So if y'all want to know more about kidney transplants, listen, you've come to the right place. Right here on the Dr. Frita YouTube channel, I have, I don't know how many videos on kidney disease, but if you go to my page, Dr. Frita YouTube, and you look at my playlist, I have a kidney playlist. So I talk about causes of kidney disease, treatments, dialysis, how to keep your kidneys healthy, 15 foods to keep your kidneys healthy, the best juices to help to keep your kidneys healthy. Oh, and you can check out my juicer on my one-stop shop, drfrita.com. I have my favorite juicer that I use, Nama J2, and I have a discount code for you there if you're interested. But if you want kidney information, listen, just come here and check it out. But I just found it to be pretty exciting that this stranger gave him a kidney, and now he'll have longer life expectancy, better quality of life, and still be able to take his daughter to the basketball camps and things of that nature. So the gift of life. Just remember, with the transplants, so we talked about liver transplant, we're talking about kidneys now. One organ donor, and I'm talking about deceased, if you choose to be an organ donor, one person can save 8 lives and enhance the lives of over 70 other people. So please do consider it. I was on the Portia show earlier this year talking about kidney transplantation and some of the myths. It is a myth if you believe that just because you're an organ donor and it's on your driver's license, that they'll just sit and let you die. That's not the case. But if you check out my Portia show, not the most recent one I posted, but the one before that, a couple of months back, I go into detail about that. All right. Any comments as we move on to our last topic and try to wrap this thing on? I told y'all we had a lot to talk about today. This is not Monday.
No comments off the free, but I will share that link to the Nate Robinson story for anybody who wants to Go back.
Oh
And
yeah,
finish
it's a great
it. Love
story.
this
You
story.
want to watch the whole thing on Nate Robinson. It's so cool. Yeah. So you'll put that link on the chat here.
Yes.
Okay, very good. All right. So now, keeping in the theme of organs, we talked about liver, we talked about kidney. Now let's talk about the pancreas. Okay, you know Raven Simone, That's So Raven, and she had her TV dad for years, Ronald Sheridan, you know, funny guy, good actor, just, you know, America's dad, that type of a thing, where he shared that he has been diagnosed with pancreatitis. So let's share that clip, please.
Friends, Rondell Sheridan here. On April the 10th, I was on the road and got sick. Went to the hospital and they thought it was gastric. I got home on the 12th, immediately went to the hospital at Northridge and was told it's pancreatitis. Tons of tests. I was in the hospital for 9 days. I got released and I thought I was on the road to recovery. But it was just for observation. My pancreas is inflamed and there's not much you can do about it, but just wait for the inflammation to go down. I didn't realize that I was going to be and will be out of work for quite some time. I'm setting up this GoFundMe to help with some of my medical bills, but just expenses. If you have anything that you could donate, I would gladly appreciate it. Thank you so much.
Yeah, Ronald Sheridan from That's So Raven. And it's very humbling that he's on here. I know some people are thinking and have commented, oh, he's rich, he's an actor. But let me tell you, if he is indeed rich, if he is indeed in the financial situation that you might think that he is, that means that he has a lifestyle, right? A lifestyle that he has to support. But now he is out of work. But let's just talk about pancreatitis. Now that's another one, Shador, when I, in my ICU days where I watched patients pass away. Your pancreas is an organ. It's like right, if you put your hand in under your chest and right on the top of your stomach, it's right kind of in that center place. It's shaped kind of like a drumstick, and it's responsible for producing enzymes that help you to digest foods, things of that nature. And as far as the enzymes, it also a different endocrine portion of it. It helps you to make your insulin. The beta cells in the pancreas make insulin, does all kinds of things. But when you get inflammation of the pancreas, it can take your life. It will, in order to treat it, you need bowel rest, meaning he can't have anything by mouth while he has active pancreatitis. And, you really are debilitated in a lot of ways. And you can go into shock where your blood pressure gets too low if you have pancreatitis, and you literally cannot live. So as he's saying, there's going to be times where he just can't work. And so it's a financial burden, not to mention a health burden, not to mention he could not live. And so the causes of pancreatitis, I'll just mention the top ones. One, alcohol. Okay, that's one of the big ones. But also gallstones can do it. You can have gallstones that cause a certain blockage in the pancreatic ducts and can cause it. And there's certain medications that can cause it as well. So just beware if you're having severe abdominal pain, especially in the epigastric area. So that's in that central area, high above your navel, below the chest. If you're having pain there, severe abdominal pain, no appetite, low energy, low blood pressure, just please check it out and make sure that you don't have pancreatitis. And so, of course, sending prayers up for him, wishing him well. And you can check out his site, with Ronald Sheridan, if you care to donate to his GoFundMe page. So we're about to do our last section, the 5-minute health check. If we have anyone who just kind of quickly has a couple comments before we get into the health minute check, especially our members, I'll take those. And then we'll do our 5-minute health check and get ready to wrap this thing on up. All right.
I do have one question from Facebook and one from IG.
Okay, let's do those, and then we'll get into then we'll wrap on up. Who do we have from Facebook?
All right, so Dars from Facebook.
Hi, Dars.
She said, is kidney disease reversible, and why is it doctors doesn't say anything to stage 3B?
Oh, I'm glad you said that. So in some cases, you can have acute kidney injury. Not that it's cute like pretty, but it's just called acute, ACUTE. And if you have that, in some cases, it actually can be reversible. So some causes of acute kidney injury include dehydration. And yes, you can develop kidney failure from dehydration. Yes, I put people on dialysis because of severe dehydration. But if the dehydration is the cause, if you're just not drinking enough water, then you catch it early, as in within the first 3 months, and the earlier the better, that can be reversible. If it's because of certain medications, like certain blood pressure medicines, lisinopril, the ACE inhibitors, benazepril. I prescribe those medicines because they are very helpful in certain situations, good for blood pressure, good for early kidney disease from diabetes. But there are cases where the ACE inhibitor can actually cause you to have some kidney failure. And so if it's caught earlier enough and you stop those medications, it can be reversed, okay? If you have it due to NSAID nephropathy, non-steroidal anti-inflammatory disease, if you're just taking Advil several times a day, ibuprofen, meloxicam, Celebrex, the NSAIDs, and your kidneys perhaps are already vulnerable, that can cause a kidney failure, an acute kidney failure, or acute kidney injury, AKI. Caught early enough, you stop the NSAIDs, you hydrate, it can be reversible. My point is there are certain types of kidney failure when caught early that are reversible. But the CKD, when it's progressed to the point where you have kidney scarring, kidney sclerosing, oftentimes the numbers can go up and down. But if it's really progressed deeply, then sometimes that's not reversible, especially as you get into CKD3B, CKD4, CKD5. Now, why is it that some doctors wait until CKD3B? Well, it's standard of care that primary care physicians, like your internal medicine doctor, your family medicine doctor, it's standard of care that they refer you to nephrologists like me when you get to stage 3, meaning that your eGFR, the number on your labs, if you look on your portal, when the eGFR is less than 30, that's when it's time for them to refer you. But your primary care doctor actually should be caring for you even in stages 2, right? Or in early 3A. And so and that's why, it's one of the reasons why I do these channels, do this media, because I want you to be your own advocate and share with others. In fact, please take a note of this. Once you finish this live, go to my YouTube, Dr. Frita YouTube here, and look up CKD stages, Dr. Frita. I go into detail about each stage, what it means, what can happen at the stage. And so even when you see your doctor and they look at your labs and they say, okay, good, everything looks fine, but you know good and well that your GFR is 53, which puts you in stage 3A. Or if your GFR used to be 80 and now it's 72 and your doctor says, oh, everything's fine, they turn and walk out the door, I want you to speak up for yourself and say, excuse me, what is my kidney function? What is my eGFR? Please refer me to a kidney doctor. Speak up and make sure you advocate for yourselves, because a lot of times the physicians, it's not that they're not knowledgeable, the primary care physicians, it's just that Big Brother is watching. They have to have you in and out of the room in 6 minutes, 5 minutes. And so the less questions you ask, the less they volunteer, the better. Sadly, it's our healthcare system. And so make sure you know your own numbers. BUN, creatinine, eGFR. Check out that video of mine, CKD stages. It's in my kidney playlist on the Dr. Frita YouTube channel. And that's a great question. So I'm really glad you shared that one. Thank you, Dars. Thank you.
Yep, Dars. All right. And then from our IG, Carl.
Hi, Carl.
Carl asked, what would be an ideal treatment for someone with stage 4 kidney disease, GFR of 29?
Okay. So the good news, at 29, you're just 1 point from being in stage 3B. So see a kidney doctor. So talk to your primary care doctor about a referral. I'm taking new patients if you go to drfrita.com. And I also do telehealth. For those of you who are not here where I am locally in Atlanta, I do a telehealth concierge consult where I can do a full history and at least give you some good guidance. But there may be things that you're doing or that have happened to you that can still cause you to be in a place where you're reversible. For example, if you're not drinking enough water, then that can be a cause of kidney disease. If you have high blood sugar or diabetes is the number 1 cause of kidney failure. High blood pressure is the number 2 cause. There could be certain medications. There might be something going on with your anatomy, in which case you would need a kidney ultrasound to assess it. You might have a big prostate. For men who are listening, a big prostate. Yes, a big prostate. And anyone who lives long enough will eventually get a big prostate, but a big prostate can cause an obstruction or a blockage. So the most important thing, instead of sitting at home and trying to figure it out, do it yourself, it definitely is time to go to see a kidney doctor in case you're one of those people who's in a place where the kidney disease can be reversed. If you've already are too far gone, which preferably you're not, but if you're too far gone and there's already scarring, there's still things that your kidney doctor can do to help to slow down the progression of kidney disease. And y'all know Shador here has been my practice manager, my office manager for more than 12 years. And it's amazing sometimes, Shador, how we see people who've gone from the 20s to the 30s to the 40s when the right thing is done in the right situation. So make sure you consult with your doctor. And meanwhile, yes, also please check out my playlist on the Dr. Frita YouTube channel, kidney disease playlist. And I go through all types of things on foods that can help to reverse kidney failure, but that does not replace a consultation with a kidney doctor. Be well. I wish you the best.
Absolutely. Thank you, Dr. Frita. Before we stop and jump into our 5-minute take, Future Fortune asked for a video suggestion. I don't think we've done this one before. Could you do a video on the seriousness of hernias?
Oh, yeah. I have not done that before. Okay, that's going to go into the wish list because there are different types. There's ventral hernias, there are inguinal hernias, and yeah, they can actually cause your intestines to not be alive. They can actually cause you to go into septic shock and not be alive, and that's not common knowledge. Yet hernias are pretty common. Okay, all right, you're on the list. Thank you. I like that.
All right, thank you, Future. All right.
All right. So as we get ready to go into the last little bit and close out for the 5-minute health check, make sure that you like this video, you share it, you give us a subscribe, please, and hit the notification bell, and you'll be among the first to know when we do new videos. Also, please give us a follow on other social media platforms, Instagram, Facebook. Thank y'all for watching. Thank y'all for, hey, replay crew. Thank y'all for watching. Give us a like. And drfrita.com. Again, that's my one-stop shop. You can get my book there, Under Pressure, A Guide to Controlling High Blood Pressure, where I talk about not only, using medicine as medicine, but using food as medicine, lifestyle as medicine, exercise as medicine. And again, you can look at my favorite things there, including my juicer, where I give you a discount code, and also my television appearances. Oh, I'll be on a national news show tomorrow morning, News Nation. I'll post it. Facebook, I'll post it there. Instagram, I'll post it for you as well and let you know the exact time and the topic and all of that good stuff. But I do a lot of national news shows. And on my YouTube channel, I have a playlist of television appearances so you can see those as well. All right, let's do a quick 5-minute health check. Let's wrap this thing up. I appreciate y'all for watching us here on Medical Monday. And thank you for making Monday your healthiest day of the week.
All right. Over 1,000 measles cases in 2025. Could 2025 be the worst year yet?
Y'all, I want to jump off my stool every time we talk about measles because y'all know we eradicated it. So we thought back in 2000 because the year 2000, because we know that we have prevention, the MMR, measles, mumps, rubella vaccine. But now, of course, with all of the misinformation and RFK Jr. with his old misinformation giving self, how he has said different claims saying that the MMR vaccine causes autism. It does not. This has been debunked. A lot of people have stopped getting vaccines and hence we're on the rise. So make sure if you have not been vaccinated, make sure that you do get vaccinated. Consult with your doctor. Look for yourself. The evidence is clear. The best way to prevent measles is through the vaccine. RFK Jr. even said that himself, finally, even though all of us scientists already knew it. So 2 doses of the MMR vaccine gives you a 97% protection. And measles is not just a matter of a fever and a rash. It takes lives, okay? It can make you unalive with encephalitis, pneumonia. So the measles cases are on the rise. I pray they come down, but they're not going to unless we get the proper education and information. What else, Shador? This was depressing.
Recall health alert. Canned beans recalled in 23 states over deadly soy.
Yes, deadly soy. So these beans, Yellowstone, brown sugar, molasses beans, I believe the 15-ounce cans, they found soy. Now, if you have an allergy to soy, it can be deadly. And it was not listed in the ingredients that soy was there. There was not a warning. So make sure if you have a soy allergy, if you have a baby who can't have soy milk and, or a young person, look at your can, look it up, see if you've had the recall, if you have these 15-ounce cans of Yellowstone, brown sugar, molasses beans, and get them off the sticks. I think off the stands in your house. I think they were like 4.5 thousand cases, something like that, cans. So that's the recall.
All right. A public health emergency unfolds in LA due to hepatitis A outbreak.
We were just talking about how viral hepatitis can be a cause of liver failure. So yeah, hepatitis A. We've known that in the unhoused community, previously called homeless, that's apparently politically incorrect now, but the unhoused community, a lot of them are getting the hepatitis A, and it can come from eating foods that's been prepared by someone who hasn't washed their hands thoroughly, like if there's fecal matter and the person's infected with hepatitis A. But now even people who are not unhoused and who are in what we call, just kind of more stable, sophisticated living situations are getting hepatitis A. So there's been an emergency. So make sure, especially if you live in Los Angeles, that you're keeping abreast of the news. And very importantly, do hand washing before you eat, before you prepare someone's food, hand washing, and we'll keep you posted. All right. Well, I thank y'all. I told y'all we were packed today with medical information. We will see you next Monday, same bat time, same bat place for Medical Monday, where we do give you a fresh take that you can't get anywhere else. I appreciate you for watching. Make sure you follow me on all social media platforms at dr.frita. And look, set your alarm clocks, rise and shine, because I'll be on a national news show, News Nation, bright and early tomorrow morning. And I'm talking about a topic that is very exciting. I'll just tell you that. It's very exciting. It is. That's all I'll tell you now. But y'all just watch. I'll post it today. All right. Thank you, Shador, for doing a masterful job at co-hosting as usual. And we will see you on next.